Welcome, everybody. As Priyanka said, my name is Amanda Zadian. I actually used to work here at Matter, running events, and now I'm at the American Medical Association working as a product manager on the Physician Innovation Network. This is a platform and it's becoming a program through events like this in partnership with organizations like Matter to bring students and innovators and experienced physicians and kind of really stir the pot to have conversations about when we see challenges in healthcare, how do we link arms and try to solve them? So I'm really excited about this panel here. We have some really amazing experience and really diverse background here. So I'm going to let them do the honors and introduce themselves. So we'll start with Dr. Adam Bennett. Great start.
Thanks, Tyler, for giving me the dozen work. I'm Adam Bennett. I'm a physician. I've been in Chicago since I was 18. I'm going to give a little bit longer introduction. It's a long road for me to get here. I'm by far the oldest. So I played soccer in college, and I wanted to go to a college where I could play for 4 years. So I went to Northwestern University because the team was really bad. And my junior year, I tore my ACL. It was clearly, for all you M1s, it was a valgus stress. My knee went this way. But the orthopedic surgeon for our university misdiagnosed it and said I was fine to keep playing. So I kept playing and ended up doing more damage to my knee and then seeing another doctor and having ACL reconstruction and then realizing how important a physician is in an athlete's life. I went on to Northwestern Medical School, liked everything I was doing, liked talking to people, so I went into family medicine, and then I did a fellowship in academic and sports medicine, landed a job in an orthopedic office where they took care of the Blackhawks, the Bears, and then I was taking care of U.S. soccer. That was about 16 years ago. My main gig was seeing patients all day, every day with ankle pain, torn Achilles, dislocated shoulder, torn ACL, arthritis. And I became a partner in our group. We were acquired by a large hospital organization. That was maybe 7, 8 years ago. And that's when I started getting interested in healthcare and technology, because I went from a pretty efficient EMR and a very happy clinic to something that was very inefficient. And one of the things I'll talk to about medical students, when I was younger, people would say, you know, do you want to work in a private practice or in a hospital? And I'd always hear attendings say, well, you want to be your own boss. And I was like, well, what does that mean? I mean, you can still just see patients. It's all about you and the patient. But when I joined this hospital organization and I had my workflow, and I would tell my assistant, who's a very intelligent person, I'm like, hey, give that patient naproxen and an MRI of the knee. And then the hospital would say, no, you can't do that. There's no verbal orders. And I was like, well, because in the ICU or in these really intense situations, verbal orders are prone to mistakes. So I'm like, I get that. You're in health risk or risk management. But this is separate. Why don't you come and observe us? We're giving naproxen. We're giving MRIs. Those are just magnets. There's no radiation. Let's apply logic here. And they're like, no, it's our policy. And I was like, uh-oh. And so then they'd make a shift. Me ordering an X-ray it used to be verbal, like order 2 views of the right clavicle. Now it was 18 clicks. And so I quickly became aware of the fact that I was inefficient and really struggling to be as productive as I wanted to. So then I started looking at ways out of that and to innovate, just because I was unhappy with how things were. I thought things could be better. And so I joined a startup about 4 years ago as an advisor, trying to make virtual visits for people with musculoskeletal injuries. So you injure your calf or your ankle, let's do a virtual visit. You can see, I can look at the ankle, and that's my first foray, and I'll go into more of what I'm involved in now. But it was mostly out of seeing how things could be better after having things go well for such a long time.
And Tyler?
Hey everybody, I'm Tyler Wonke. If you got sort of a year for every year of medical school, M1, M2, and so forth, I'd probably be, I think I'm an M9 right now. I'm an M9, something like that. I started in 2011 at Northwestern. I did my undergrad in pre-med and neuroscience at Wisconsin, but really liked business. Actually ended up studying business too. So when I came here and was doing medicine all day, I thought, man, this is nice, but I kind of got the idea and I was bored a little bit. And so I said, well, what can I do on the side to have a little, activate a little bit of the other areas of my brain that I had, being an undergrad. And so I started taking business school classes at night at Northwestern. In those classes, ended up meeting a gentleman who took 2 years off from his surgery training to innovate a new medical device program at the time at Northwestern that was like Stanford's biodesign program, if you've heard of that, for innovating new medical technologies and devices. And together with a team of some surgeons and Dr. Dan McCarthy there, we ended up inventing this new device to help treat cancer patients with sort of an advanced type of ablation technology, essentially a fancy type of RF ablation, and specifically for breast cancer. So I ended up taking leave of absence from medical school right after my second year, took my step one exam, and then on my birthday, and then the next day I said, well, now what the hell am I going to do? And ended up, we didn't have Matter at the time, ended up just talking to one person and then the next, and then finally ended up learning from others and some programming we had at the time about how to start your own company. And so maybe I'll tell you more about it in a second, but long story short, we ended up starting the company. It's called Innoblative. We raised a couple rounds of funding, raised some grant funding, and we're able to just get FDA clearance and CE Mark international clearance on the product that we thought about years ago. So with that in hand, we've sort of matured as a company. We hired a veteran CEO to take over, and now we have a team of about a dozen core people and many dozen more consultants that we work with. And now I'm back in medical school as an M3, and this is my professor actually right here.
The perfect team. Bilal?
Hi, everyone. Thanks, Matter, for having us here. So my name is Bilal Naved. I am in the MD PhD program at Northwestern. So I'm kind of in between M2 and M3. I'm a G2. Just started my second year of grad phase and actually had my first thesis committee meeting earlier today. So I was telling Amanda I only ever had breakfast before this pizza. But my background, I grew up in Maryland, went to the University of Maryland, studied bioengineering there. That's where I met my co-founder, Adil Malik, and actually there's 4 of us co-founders, and I met 2 of them there, and our first co-founder I met in high school. But through college, Adil and I were kind of working on various entrepreneurial things. No companies, it was student chapters, and we built a nonprofit afterwards. But we were always kind of brainstorming among ourselves, what problems do we care to tackle together and inspire, a group of people towards. And so we were both pre-meds at the time. And afterwards, we kind of took divergent paths. I went on to the program here at Northwestern, and Adil went on to Accenture, where he was doing healthcare and life sciences analytics consulting. And he got fortunate to be working with kind of global MDs on projects directly with Samsung Health and Merck and Pfizer, and saw tons of hype in the digital health space, lots of resources going, but also noticed that those corporations are corporations and they like to try to innovate, but they're not able to be as agile. And so, one day on vacation, Adil was kind of telling me all this and said, let's start something. And I, on the other hand, was in a few months into medical school, and my friends and family were calling and asking me, like, what do I do for my sore throat, my hurt toe, my tummy ache? And I'm like, well, I haven't even taken those units yet, so I don't really know. But, so I'm but it got me thinking, what does the average person do when they're not feeling well? They go Google their symptoms and end up with more anxiety than answers. They try and call a friend and end up with no answers. And not everyone has access to a healthcare professional in their family or our friends network. But in medical school and when you're being trained, there's a lot of really algorithmic questions that you will ask someone when they have a cough or a fever or something. And so I wondered, why can't we bring those algorithms right to the people and give them clear steps for their healthcare? And we kind of converged on that idea and started from there and never stopped. And our company is called ClearStep as a result. And what we do is we build what's called digital front doors and license it out to health systems and insurance companies to allow their members and users and patients to search for their symptoms in free text, go through a dialogue of questions that are all multiple choice, 10 or so, and then be routed to what the next best step for care is for them. So whether that's stay at home, you can take care of this, go see a primary care physician with a few days, go to urgent care, call an ambulance, and match you to providers and facilities that are in your network and allow you to book your care that day, to create a better patient portal so that no one will ever have to call their medical school trainee ever again.
Scary.
It is. So, yeah. that's me. Yeah.
That's awesome. Thanks everyone for sharing. It's really helpful. So I'm curious about that process when you first started out with that idea. I see a problem in market, or I see a problem in practice, or in the process of being a patient or having a loved one go through the experience. What did you do next? Like, what was that itch that got you over the hump to say, I've identified a problem and now I'm going to go do something about it? And what gave you the confidence to be the one to do it yourself? We'll kind of go down the line.
Sure.
You should answer this one first because I
Okay.
think you had an idea.
Yeah, I forgot what I said when you asked me this earlier, so I'm going to just freestyle it again.
Go
Let's
for
see
it.
if I do as well. So when we first came up with this idea, honestly, it kind of just passed through me. Like, I was walking to 7-Eleven, I had the thought and just never acted on it. But when Adil revived it and said, let's do something in the space, I know there's a lot of opportunity here, got us thinking. And so we actually, and if I could go back, might have done it different, but at the time, thought more about the business models. Like, how would we sell this? Who would we sell it to? Who really cares for this? Like, do we really want to build a direct-to-consumer company? We don't have the network or the capital to do that. It's a very expensive proposition. So if we're going to go sell to health systems, what's the value prop and why would they buy this? Because in the fee-for-service world, we are optimizing care and reducing costs, and we're not necessarily helping make more money. So we had to figure out all of these little things. And, Adil would fly to Chicago on his Accenture budget and help, and we would work on this and try and figure out the market size and all that. And it wasn't really until we applied for Y Combinator, which for those of you may not know, it's an accelerator that's based in San Francisco, Palo Alto, and Airbnb, Dropbox, Reddit, Twitch, a bunch of these companies came out of there. And we applied there, and it forced us to answer a lot of these questions, and we got to be finalists and go out. And we went out and got torn apart and realized that we didn't know as much about the consumers and the users that would be using this, and also how we would actually build the technology. And so that got us thinking more on where would we get all the algorithms? Were we going to build all the protocols ourselves? Were we going to partner up with someone? And it gave us also the sort of the validation that we might be onto something, because we're surrounded by all these very esteemed entrepreneurs, but they're inviting us with nothing really to show to talk about it. So that was kind of the first step for us. And then from there, we just kept trying to solve each of those problems, answer some of those questions.
So we had an interesting way to come about Innoblative, as I mentioned. We were starting, or I should say Dr. Dan McCarthy was starting this new program that was going to be like biodesign. Does anybody people know about biodesign program? You guys learned about medical devices last week if you were here. So the idea was to eventually be able to put engineers and young physicians together to help innovate new ideas, in the operating room. At the time, it was just this one physician. And so he was really kicking around ideas with a couple of surgeons at Northwestern. And he ended up teaming up with this guy named Dr. Dave Mavi. Remember Dave Mavi? He used to run the surgical oncology division at Northwestern. And they were kicking around some ideas, and all of a sudden they noticed that there was a colleague of theirs down south who was a breast surgeon. And she was taking an existing medical device and repurposing it, if you will, to be used in breast cancer where it hadn't been used before, in a new clinical setting. And I'll tell you exactly what she did, but from a high level, she was using this existing device made for liver cancer, which Dave Mavi, treated every day, in breast cancer. The only problem was the device didn't work great for the job. So just to tell you a little bit more specifics, you may know that one of the ways that we treat liver cancer these days is if it's the appropriate patient, we'll go in with a needle or a set of needles, and we'll use radio frequency energy or a similar microwave-like energy and actually thermally treat the cancer right in its place. In fact, it was some entrepreneurs sort of in the 90s really that helped show that, because they noticed that with the Bovie pen, which you all know gets used in surgery and other technologies, that they could sort of they could treat an area of tissue, and by using multiple needles and saline irrigating them and doing different things, they could treat more and more tissue. And pretty soon, when ultrasound became popular, they realized, well, now we can see these lesions that we couldn't otherwise treat in these patients that we wouldn't otherwise do surgery on, but what can we do about them? And here was these RF probes. And so over the course of the 90s and 2000s, it actually was in large part entrepreneurs that helped take what was being done in the academic setting, developed new user-friendly products. These radiofrequency ablation probes or needles. And they ended up helping treat lots of patients, grew their startups from nothing to tens of millions of dollars in revenue a year, helping thousands and thousands of patients, sold those companies to bigger companies, and it was sort of a success story. But again, those are for liver. In the breast, like many other areas of the body, it's sort of a different clinical environment. The tumors are relatively superficial, so you can take out the tumor. It's not that you can't operate, you can. And so really what you're concerned with is not so much the tumor itself that you can operate on. You're concerned with cancer that could be left behind. And that's really what this surgeon, Dr. Klimberg, ended up doing, is she took one of the existing RFA devices designed for liver, and specifically one that had a couple tines. Think about it like an umbrella without the skin. So it would sort of expand into place like an umbrella. And works great for non-operable liver tumors because it just sort of expands these needles into the tissue. But in the breast, you're left with a cavity, and so she did her best to sort of use sutures to try to pull the tissue in close enough that she could deploy the needles. But her and more so a lot of her collaborators said, well, this is a great procedure, we love the idea of it, but this device is kind of clunky. We're never sure if the needles are in the right place. Are we transferring the RF and actually treating 360 degrees of the surgical site? And no one really knew for sure. But the early data was really promising that this seems safe. Patients seem to really tolerate it in the early clinical studies. And it seemed to be effective, at least with some early data. It was just maybe the wrong tool for the job. And so that's really when they set out to say, well, what would be the right tool for the job? And it was that classic sort of workaround of watching a surgeon in this case, or a group of surgeons, deal with something that was already out there and just try to make a square peg fit a round hole, so to speak, that led them to, drew the initial drawings of what this device could be. And from there, and that's when I got involved, we literally took it from hand drawings on a piece of paper to now, like I said, an FDA cleared device. We have a clinical trial going on at Northwestern, early stage clinical study. We've raised $11 million, to support that business, and I think the company's well on its track to being able to help a lot of people. And it all started with just noticing that, there must be an easier way to do this.
That's awesome. So, Dr. Bennett, I'm really curious what you think of some of the innovations that have come to you as innovators say, I want your feedback on this, or when you've been given an opportunity to work with something that's kind of new to you in practice, and maybe you can share the story as well of how you got involved with Kitri.
Yeah, for me, probably the easiest way for me to explain how I got here is I joined the Physician Innovation Network, the AMA. It was a great, backing up, I was an advisor for a company. As an advisor, I don't really get to make major decisions, and I felt like I wanted a little more leadership role, so I reached out to 20-something companies on the Physician Innovation Network and started having dialogues regularly with people with different ideas, and some of which, like, that's not a good idea, others, that's totally not my area of expertise. And then ultimately I was approached by someone local from Chicago who had this very high-tech digital health tool that uses persuasive technology to basically optimize wellness in people who need it. And you might think, well, that's not very hard to do. There's Weight Watchers and other things, but healthcare, we don't historically do a great job of prevention and wellness. There's not a lot of incentives to fee for service. So if you're optimizing wellness, you're basically reducing profits in your hospital. So I had this great tech option, and they came to me and said, hey, where could this fit? And obvious stuff initially was, well, cardiology or diabetes, and they had thought of that, and those were complex, I guess, clinical scenarios. So my light bulb moment was when I was in clinic with one of my patients who was morbidly obese, 45-year-old female, bilateral knee arthritis, end stage. I was like, you need to lose weight. And she's like, well, I can't exercise because I can't move, yet I'm too unhealthy for a knee replacement. So I called my colleague who's, all he does are knee replacements, which, that's just really boring. I think if all you do are knee replacements, you guys can figure out your careers eventually. My guy, he can't even deal with a cold. He's a board-certified orthopedic surgeon. But knee replacements he can do. So I'm like, all right, what do you think about this wellness tool? And I don't mean to offend anyone. He's like, well, geez, we have nothing good now. We send people to fat camp, and they don't even go. They don't like it. It's not convenient. So I'm like, well, what do you think about this idea of rolling out to your patients? He's like, that's awesome. Like, it sounds like it's not that expensive and it's convenient. So we tried it on about 60 patients, and shockingly, it worked quite well. There seems to be a moment where a patient we have other content explaining how if you're overweight or you smoke, your diabetes isn't well controlled, and you have a knee replacement, your rate of infections, complications are much, much higher. And as my colleagues say, knee and hip replacements are high consequence failures, meaning they're very expensive, they're very painful, they can cost hundreds of thousands of dollars to redo. So if we can prevent a few of them using convenient technology, then that's a win for everyone. So in terms of where this fits in the healthcare climate, we're figuring that out, but we have a few hospitals using it, patients like it, and status quo, I guess for me, status quo isn't good in our hospitals. We're not doing a great job of optimizing wellness in people, and a lot of patients don't realize their risk factors are a problem, just day-to-day life, but when you look at pending surgery and you have a 22% greater risk of a blood clot, all of a sudden those risk factors are very meaningful to them, and so their engagement is much higher. So I don't know if I answered your question specifically, but that's kind of what the light bulb was for me, and part of it was hearing different ideas and thinking through, well, what do I do every day, what do my colleagues do, and how would this fit in, would this help, would this hurt, would this be better than the status quo, and I mean, I think that's what everyone's sort of describing.
Yeah, absolutely. Thank you. So when it comes to getting good feedback from physicians, I mean, you mentioned you reached out actively to 20 different companies because you actively wanted to be involved. Do you have other colleagues who are also as interested in getting involved in innovation as you are? Do you feel like they want to be asked, they want to be involved in that?
I think in general, I'd say no. Most of them don't. I have a few colleagues who do. Looking back, even when I was a resident, this is going to date me big time, but at the time we had these little books and we'd have to look up, you know, medication doses, and you get the same, it's tiny little, that was blue or yellow or gray. I don't know if anyone knows about those, but I was like, hey, there's a thing called a Palm Pilot. It's not even connected to a phone, but I presented to my hospital's organization. I'm like, you know, we can download, you know, data that will tell us all of the different doses and the side effects and complications. So I actually presented a Palm Pilot to a bunch of our administrators, and they got it for all the residents. I'm like, this is just a no-brainer. I mean, you're going to save people time, and it's going to be a safety issue. So I was always wanting to improve things. And in my world, in orthopedics especially, there's a lot of very, very busy physicians. And I feel like those physicians are probably the ones whose input is needed most, but they're the ones least likely to have time to contribute. And what I see is a lot of academic physicians, a lot of part-time physicians, a lot of physicians who didn't maybe do 5-10 years of training, which is great because they're still, those people are needed, and they're needed to you know, I think just promote medicine and to help us progress. But the doctors in the trenches that deal with patients day in and day out and know the pain points and how patients are going to behave, I feel like those people, I mean, I was able to tell my company, it's called Kitry, you know, though this is going to work, that's not going to work. People aren't going to do that. Surgeon's not going to do that. No way is that going to happen like quickly, and then we're able to kind of get to a meaningful product where it fit in with everyone's sort of decision processes. So
That's a really helpful perspective. So everyone here in the room, think about what is today's Palm Pilot that you need to present to your own hospital when you get there. Because really you're seeing it right here with years and years of innovation building on itself. And I hope years down the road you look back to this year and say, when I made that presentation, it seemed silly now to think about in terms of the technology advances, but it really is moving fast. So Tyler and Bilal, I'm curious, how do you get feedback from physicians like Dr. Bennett, as well as those who might not be as easily accessible, those that are in the trenches, as he says, and how do you kind of pull them out? What are some of the resources that you've used in order to do so?
Yeah, so you know, we were developing a medical device, and so it was really important to get feedback from you know, different surgeons mostly and other interventionalists who do the procedure. And you know, you're right, you really got to talk to the folks who are doing it every day because they're going to have a different perspective. So I think pretty much everyone's medical students or you know, sort of similar. You know, we really use that to our advantage to come and approach it from a sort of quasi-academic perspective, which was, hey, we are, and we were, you know, students working on sort of an entrepreneur project where we want to come and you know, get your perspective on our technology. And so we would go, and eventually we would have like sort of a somewhat formal list of questions we needed to be answered. And you know, we would go to conferences, like the big conferences for surgical oncology. One of them is the Society for Surgical Oncology. For breast surgery, the American Society of Breast Surgeons. Every medical specialty has their own conference. A lot of them are here in Chicago. That was a big way for us to sort of get access to physicians, because they would be there and they wouldn't be, with patients all day, every day. They'd be, relaxing a little bit, going to meetings. So we'd go to, conferences. We'd go visit them at their, in their setting, like at their hospital or their clinic, and on their time, which might be 5 in the morning or might be 7 at night, but sort of meet them where they were. And really we approached it from the idea that we were a little bit of like the underdog student academic team, just trying to help patients. And when we did that, we were more successful connecting with physicians who otherwise might have been a little, adverse to business folks, and what are we trying to do? Make a profit or something like that. We've heard all that. But we were able to connect with a lot of these surgeons and get dozens of surgeons' feedback that was needed to help ultimately develop the right device. In fact, the initial device that we had thought of that I mentioned was hand-drawn, and I had my little sister, by the way, do the graphic design for our patent. It was like literally like a garage band. It was like, hey, can you take this pencil drawing and put it in a computer? That was 2013. But it really was quite a transformation if you could see the device that it was then, which, by the way, it was like a ball with a bunch of electrodes, needles that came out of it. So it actually wasn't that much better than what we had. Now it's like a much more elegant design. There's no electromechanical, mechanical componentry, really. So, well, what does that do for your business model? Well, it saves on your cost of goods sold, so you can offer the device at a lower price point and get it in better. Also, much more reliability from an engineering and quality perspective, because less chance that the mechanical components break. And it looks a lot better, and quite frankly, it's a lot safer because there's no needles. So, well, how did we get there? It was from talking to a lot of the people that really knew.
Question though, sorry. So walk me through when you were at PGY2, is dealing with a surgeon who's been doing 20 years of breast cancer surgery, who has just rich experience. What's that dialogue like? I'm sure, I know that when I'm even talking to one of my colleagues who does spine surgery, sometimes they talk over my head. What was that like, if you don't mind? I'm curious.
Please.
Yeah, that's a good question. I guess like anything, like, you do need to talk the talk. So for us, it was a little bit of a, it's a steep learning curve to try to get there. And you're never, it's hard to really get there. It's, and to replace experience, it's tough to do that. But then again, if you could do that, then why would you need to go to the people? So you do need to be able to talk the talk. You need to be able to figure out, if I may, what is important for this innovation. If it's a device, if it's another business, you got to think about like what's really important here, and you focus on that. So you do need to know what's going on. For us, it was like, okay, here's all the features we could have in the device. Which ones do we think are really going to be important, or which ones do we even want to spend the 10 minutes of time we have with this physician asking about? So we had to sort of narrow it down, and luckily we had some experienced engineers who knew kind of how to do that. From industry, from the big companies. But that's really what we ended up sort of having to do, is learn a little bit of the language. Out of the million things we could ask and we could spend time doing, what do we think was actually going to matter, narrow it down. And then a lot of it was, learning on the fly from just having conversations. We learned things that we didn't even consider in the device. We thought, these are the things that matter, like I said. And then all of a sudden you talk to one physician, they'd be like, did you think about that one other feature? Like, did you think about how that could cause this to happen? And then maybe we hadn't. And that added something else to the table. So if there's one thing I think maybe holistically that you should think about, is if you're dealing with like any innovation, whether it's a device or app or maybe even drug, like if you're going to do innovation, if you're going to do entrepreneurship, the one thing you do need to be is very adaptable. And actually a lot of times it's the people who are adaptable and resilient and persistent, and they roll with the punches and they pivot, that eventually figure it out. It's almost always not what you thought it was going to be. The end successful solution, whatever that is almost always not what you think it's going to be on day one. And it's the people that are persistent, resilient, that outlast everyone else, that are curious, that are the ones who actually end up delivering at the end of the day, and who listen, because you really got to listen to the physicians and you got to listen to all the other stakeholders, to make something that's going to last.
That was a really good answer. I don't know how much more I can add, but I'll say that, a couple points to emphasize that Tyler just mentioned. Number one is being a student's almost your golden ticket to like any door they're in the institution, particularly like at an academic institution, all the attendings there understand that they are at an academic institution, that you're a student, that they will likely be reached out to for, even if you're not an entrepreneur, just to be shadowed. And so that's one of the advantages that you as a student have, and you should definitely take full advantage of that as much as you can. Second thing is, Matter is here for a reason, and it's a really, really good environment. And not just Matter, but there's a ton of competitions out there, which is where we got a quick exposure to a lot of feedback in a matter of an hour or two. And a lot of times you will find physicians who are entrepreneurially minded there in attendance, because that's why they're there. So, in the evolution of our deck, we almost kind of trace our company's growth with the evolution of our deck. You can see it. If we just gave you our decks and looked at them evolve over time, you could almost pick when the inflection points were in our company with pretty good accuracy. And you want to take that approach to the way you pitch. You want to try and be as and this is going to Tyler's point about being strategic in your conversations, being able to talk the talk. You don't go into it day one knowing the talk. You kind of iteratively get there, but it takes you being really honest with yourself and asking almost after every conversation, what went well and what didn't go so well, what did I not have answers to, and what are those answers, and find those answers, and modify the way you answer it slightly, and start just real-time assessing how are they receiving this, how is everyone receiving this. And you want to be able to go to every conversation and walk away, at least if you haven't learned something for your company, have learned something for how you tell your story. And so I think that the summary is trying to get a lot of feedback. Play up the fact that you're a student, and try and be as critical of your own story as much as you can, so that when you eventually, you've pitched 1,000 times and you become the subject matter expert on your specific field.
I would like to add to Bilal's point about the golden ticket. As an older attending, whenever I'm pitching to my colleagues about the product, I have to have all my words down correctly. I can't say knee replacement. I have to say total joint arthroplasty. I have to say unicompartmental. I have to say, bundled payments, and have everything down. When I'm talking to an administrator, I have to look at their workflows. I have to know their lingo. And if I don't, they're going to be like, I don't know about this guy and his company and who he represents. They're clearly a little JV, junior varsity, which means not good. Whereas you're a student, you're like, hey, I'm here to learn. Oh, look at that bright, energetic person. Way to go. I do think it's a if you're looking at a time to innovate, and you're expected to learn and grow, versus someone who's maybe a little older, it's like, you're still learning, but you kind of have to hide it. So you guys are lucky. You guys are lucky.
So you still have to know your stuff.
Yeah.
You still have to be adaptable. And you really need to use this time, what I'm hearing here, to recap, is to be that student who says, I'm banging down the doors because they're half open to me right now. And there are folks that want to participate and be helpful. Being in this academic situation affords me that. I'm curious, Adam, how you've counseled some companies and what type of advice you've given them when you've seen them maybe not doing things that you would or that you'd recommend, and without naming names, what have you seen out there that might be something not to do?
So I would tout that I'm a successful doctor. I've been a doctor for professional teams and whatnot. I'm not pretending that I'm an expert entrepreneur or innovator. So that said, I've been involved in this for 4 or 5 years. I have some good friends in healthcare startups and venture capitalists, and I always pick their brains and have coffee with them and whatnot. And it's interesting to me because I feel like there's a lot of people who are making decisions who have money and they're not clinicians, and they're funding companies that aren't doing things the way I would, or aren't kind of fitting into how things actually work, but because they get the right ears and the right funding, they're able to continue. And a few I've seen, one was a physical therapy group that was going to do virtual physical therapy, and my first thought was no way, because patients love hands-on. They love talking, looking, getting, having someone fire a muscle. You have to squeeze the muscle and they feel the texture of it, and that's really important. And I remember people saying, no, are you kidding me? You can just watch this video and your PT's done. This is a company that raised like $12 million, and I had colleagues funding it, and I'm just like, well, I know patients, and I love the idea. I hope it works. But my blink response is it's just not, because I have a lot of patients who do physical therapy and they like that hands-on component, or like modalities, which are like electrical stim or ultrasound or ice. You can't do that. And then lastly, I noticed that I used to give patients handouts, and a lot of them would get back to me. I'd be like, here's your new knee exercise or ankle sprain exercises. And early on in my career, people would come back and they were actually worse off because they weren't doing them correctly. They didn't have the right posture. So, and a lot of those things wouldn't work if all you did was give someone videos and say, do these exercises. So I have the benefit of that, but I'm, again, in no way an expert entrepreneur. I just know clinical medicine very well at this point.
Which is a great example of how an expert in the clinical side needs to have access to experts in the business side as well. Yeah, I think one thing that Sling and Matter and the AMA and Y Combinator and so many of the other collaborators that we have on the AMA side that Matter works with, that a lot of your institutions represent, are really trying to make that happen for you. So I would sort of say, anyone who has an idea tonight and is looking for feedback on that, let's talk. You can connect with the panelists, connect with me. My information is up there so that we can help you get the resources that you need. I think that's a really great point I didn't want to miss. Along those same lines, a few of you have mentioned just interest in business and having this kind of interdisciplinary approach and loving medicine, but then also wanting to have one foot in the business side or maybe on the engineering side as well. So what have you found? I know it's going to be a different story for each one of you, so I'll let you kind of take it the way you want to, but what have you found has been some of the most important things to get expertise from a business perspective on, rather than relying on, you know, some of your colleagues that are in medicine as well? Anybody can take it.
All right, I've been talking a lot, but so when I first started, just thought rich people would just give me money because I had a good idea. I'm embarrassed to say that I thought that at one time. But what I realized is that, you know, you've got to have conversations. You've got to understand people. You have to answer very smart questions, I think, that you get peppered with out the West Coast. So I've had to learn so much when it comes to how a business person values your idea, evaluates your potential. I still think I'm very new to it, but I'm learning. It's been awesome. I've really enjoyed it, but it's something I don't think you can practice enough. I know I started watching Shark Tank a couple years ago because it very much like resembled some of the stuff I went through in talking to people in business. Quick questions, you got to know your product, know the market, and if you can't answer it quickly, you're going to sort of stumble and it's not going to go all that well. So I think, does that sort of answer your
Very
question?
helpful, yep.
So I think really, really helpful to know is an understanding, and it'll never really end, but how the healthcare industry works. It is a very heterogeneous and complex place, and understanding where your innovation is going to fit into the business models, the finances of everything. Some systems are risk-bearing, and so, you know, they get compensated based on how well the outcomes of their patients are, whereas others are fee-for-service. And then the difference between ACOs and HMOs and all the other acronyms out there in the world, and how certain things are reimbursed and aren't. And these are things that we just kind of have to pick up on the fly, because yeah, we get a little bit of an education of it in medical school, but I feel like we don't really learn it until you're practicing and you are having to track your RVUs and kind of whatever else, you know, I'm going to have to deal with one day. So, you know, whatever you can do now to kind of learn that, and there's fun ways to learn it. You don't have to keep your head in textbooks. You know, I think that would serve you well when thinking about how to innovate in the space.
Yeah, and I guess I may have you know, my perspective is a little interesting because I started out just, you know, medical school and had a little bit of business education. I actually wanted to do a little bit more of the academic thing for a little bit. So I was taking these business classes at night. So at Northwestern, they allow that. Is anybody, who here is from Northwestern? Anybody? A couple of people. So you may know, and maybe at your medical school or residency, you may have the ability to take classes at night. And for Northwestern, at least, they'll pay for the medical students to take like one non-Feinberg School of Medicine class a quarter. So that's actually what I did. After a quarter, I kind of said, okay, I get medical school. I'm going to take one business school class a week. So on one day out of the week, I'd go at like 6:30, and for 3 hours have, you know, my one class a week and take one class a quarter. And I did that for a little while, you know, every quarter. and got to learn a little bit more about the healthcare system. Took healthcare economics essentially. What the heck was the other one that I took? I ended up taking like a class in operations management. That was totally interesting. It was like, the same formula that you use to like figure out how the body replenishes red blood cells is pretty much the same formula in science that you use to figure out like how a product makes its way through a manufacturing line, etc. Interesting. My point is, I ended up going that route a little bit, and then when we decided we wanted to move forward with inablative, which by the way is because we got a $5,000 grant, and I called my mother and said, hey, we just got a $5,000 grant, so I'm dropping out of medical school. And she started crying. That's when we really, I decided I wanted to go and do the company full time, but I wasn't quite ready to just jump in with only $5,000 and not have anything going on. So I actually went and did my MBA at Kellogg, Northwestern's business school there, the Kellogg School of Management. And so I did get sort of a formal business training, which was nice. I got to learn a little bit more myself about what matters in business, and that helped me connect better with our investors and other business folks to help understand what was going on. So that's always an option, to actually get some training of your own. That said, if we're talking about entrepreneurship, and I think we are tonight, really there's a lot of things in entrepreneurship you actually can't and won't learn by just going to business school. Just like there's a lot of things about that, even a medical, startup that you won't learn by going to medical school or even being a doctor. A lot of it's stuff that you learn by going out there and just doing it. In fact, I think there was a famous entrepreneur investor, I can't remember who it was, who rather than putting $250,000 of his own cash and getting an MBA, he invested it, split it in 10, and invested in like 10 companies, 25,000 a pop. And he said, this is going to be my education. And between all those companies, he learned a lot. Probably learned more than he would have just by going to business school. So that's something to think about. You have to think about, how to communicate with business people, but you also got to think about balancing, like, does that mean education for you, or is that just going out there and doing it? Either way, it's about, it's about working hard and like learning what matters to the person in front of you, the different stakeholders at the table, the patient, the hospital system. Depending on what your solution is, you really need to know who's at the table, for your innovation and what matters to them.
Really bringing back the human component to it, whether it's your patient that you're talking to. Bilal's talking about building something that patients need to use, but you really do have to pitch it to the health system and who's going to pay for it. But really knowing who your stakeholder is so important. So thanks for bringing that up. Okay, so I have 2 more questions, but then I also want to save some time for audience questions as well. So if you guys have any, I will get to you. What are some of the existing problems in healthcare that you continue to see as a practicing physician, as innovators who might want to tackle something next? What is on your horizons? What are the things maybe that just annoy you? Maybe you don't know a solution to it yet, but anyone can start.
EMR.
How did I know? How did I know?
I could vent for hours. And I don't know if it's affected you guys as much, but I have, when I joined this larger hospital organization, I had 12 very productive colleagues in all different parts of orthopedics, and we were very successful in converting over to something that made healthcare less productive. It was very frustrating for everyone. Some doctors even quit. And to me, that was the first time I was like, all right, physicians need to be at the table when it comes to making decisions. And so I decided to participate in that process. I joined our hospital's digital health initiative, which I quickly realized was not a digital health anything. It was basically the app that the hospital uses. It was very user unfriendly. Not to rip on my hospital. They tried. I will say the administrators, the people who implement the EHR, everyone cares. They're not out to like make your life harder. It's just the information they were given, decisions they had to make, the process they went down, ended up in a situation that for me is the first, second, and third largest problem that my colleagues currently face. And it's sad because lots of money is being poured into it, and it's hard to change in healthcare. There's very few incentives to, so it's difficult. But to me, it would be that.
I think one problem that really faces the entire healthcare landscape for all of us is every other industry, you'll never go and buy something without knowing the price. But in healthcare, that's not the case. And we have to go get our care without knowing the price and what it'll cost us in the end of it all. So, and it's a very like complex and multifactorial reason as to why, but whoever figures it out will do pretty well. Yeah.
Yeah, I guess just sort of related to that is, a big theme really is that in terms of healthcare, like spending, we really are spending a lot on healthcare. It's growing really fast. I don't need to go through the numbers. You guys know that. And so one of the things we see in the med tech world and in other areas is really a focus on, driving, how can you do something, as effective for less costs, or, just have a good, value proposition. And I feel like here, talking to older entrepreneurs and even seeing some other companies out there, traditionally there had been, at least in med tech and maybe other industries, there's been this idea that, if you create something that works great and maybe even creates better care for the patient, higher quality of care, it's going to get paid for. And I would say that maybe there's some truth to that, maybe, but honestly, you really got to be thinking about these days about like what is the value that you're bringing and what's it worth. We're in medical devices, so we talk to these value analysis committees. And essentially, if you have a new medical device and you want to get it into a hospital, the high level of the way the system typically works is in the fee-for-service world, for example. The way it typically works is, you'll go to the hospital and you'll need to get their permission for them to buy the medical device for the surgeon or user that you want to have use it, so that they can use it. And the payer, which is usually the insurance company, but it could be the hospital, but it's complicated, needs to pay for it. So you need to get them to pay for it. So it's one of the only things where it's not like a lot of other economics where you have a buyer and a seller, and it's the classic thing. It's literally, getting the doctor to want to use your technology, and together convincing the hospital, if it's a hospital thing, to pay for it, or to buy it, and then also making sure that makes sense with the payer. Crazy, right?
And the hospitals say, well, why can't we get all 10 surgeons to agree on the same instrument, and that way we can cut costs and buy them in bulk? And then, like, well, I have preferences. I prefer the good ablator.
Yeah, exactly. But here's what I'll say. The summary of it is what I've heard from a lot of these value analysis committees. And actually, we started one other company. It's called Edge Surgical. It's an orthopedic device company, and we are trying to bring the idea of taking instruments in the orthopedic and spine OR that otherwise are sort of simple instruments, but they're analog digital. So you can tell how fast medicine moves sometimes when literally we're just making we're taking a thermometer from analog to digital in year 2020. But anyways, it's a big thing. But
we still fax, so still fax.
I faxed today.
That's why the EMR is so slow.
Yeah, I faxed today. I'll be honest, I did too. But so what's my point? So literally, you need to convince these committees that they're going to do it. And one thing I heard from all these committees, say you have an innovation that turns to the hospital, is, if it's another technology or device of which already some exist, it better have a real cost advantage, like a significant cost advantage over the others, whether that's buying in bulk or whatever. Otherwise, you're going to be in a battle against the big players that have devices there to get it in there. That doesn't mean don't try. I don't want to be pessimistic, but think about what's the value you're really bringing. Compare that to a device that is first in class, because you worked hard and you came up with something that really is differentiated, maybe nothing quite like it, or it just does the job so much better and or for so much less cost that you really just can't. There's not a logical argument to not go for it, assuming it's good quality. Those are the devices that I think get in. We brought, for Edge Surgical, we had the first digital depth gauge. It's a single-use device, so no risk for kind of like contamination, and it's a magnitude more accurate and precise than what's out there. It's actually, there are other devices that measure how long of a screw hole you need to put a screw. They exist. They're analog, but Edge has not had a problem getting in, to 100% of the hospitals that it's gone to, because the value prop has been so strong. In other words, the cost is so low for the value prop that you're bringing in terms of precision, accuracy, and then no risk of bioburden, that 100% of the value analysis committees have said, sure, that makes sense. So just think about that. When you're innovating something, is really the future trend, I think, is going to be doing as good or better of care for less costs. And rather than thinking about bells and whistles and this new fancy thing, think about that, but really at the end of the day, say, how is this going to significantly drive down, costs for the same care or better care for less costs?
And given that there are so many issues that we see in healthcare, there's no need to be repetitive in the same spaces. There's plenty of white space and opportunity to grow. So I'm sure that there are some ideas in the audience. I'd love to open it up. Does anyone have any questions that they'd like to ask the panelists? Feel free to just raise your hand, stand up.
Any questions?
Like, how do you balance it and all? Yeah, too.
I can answer that one because I have a full-time practice, I have a family, and I take care of a team, so I'm always busy. However, I have an hour-long commute on my way home and a 35-minute commute depending when I leave in the morning, and I'm a podcaster like nobody's business. I've learned so much. If I need to learn about a different space or a different digital health tool, I will I will search for podcasts and listen to those, and I learned so much. And a lot of times I'll get to the office and then I'll listen to two people and I'll reach out to them on LinkedIn and I'll quickly sort of increase my knowledge. And then on the way home I have a work meeting on my commute home every Wednesday at 5 with my founder and some other people. I squeeze in at lunch or other times just on the phone. We have Zoom meetings. So technology has really allowed me to do a lot, and frankly sometimes I'll be a break between patients and I'll have a really energetic, creative conversation with someone, and then that actually helps me be a better doctor because I walk in there being like, oh, I just had a good meeting, and I'm not just seeing the same knee problem over and over. I'm doing something different. So I would say I'm busier, but I'm more fulfilled. And if you're smart about your commute, your podcast, everything else, you can pull it off.
So I think my perspective is sort of interesting from the perspective that I left, and so I was a full-time entrepreneur for 4 years without after MBA. I just literally was running the company, CEO of Innoblative, and so lived that full-time lifestyle. That was my baby, and that's all I was really focused on. So I've seen it that way, but it's really interesting for me because I still do want to finish medical school, and I'm back doing that. I still want to practice. So, last week I was thinking, well, what can I do? Maybe I can talk to some wiser physicians that have a good perspective. So I walked into a session about taking primary care and taking care of patients late, and this guy was there. So that, if you have any questions, he's the guy to go to. But no, seriously, for me right now, I've found that being involved in innovation and entrepreneurship is something that matters to me. I get a lot of I get a lot of pride. I'm happy. I'm excited to be able to do that as part of my life. And so right now for me, it's deciding in my career, how can I pick a medical specialty, a residency, if I'm going to do one that's going to allow me to have that as part of my life, one way or the other. Because I still want to see patients. I still want to have that one-on-one provider and patient connection. That's important to me, and that's a large reason why I went to medical school. But I also want to continue to innovate and be able to bring new technologies and innovations to patients in that way too. So for me, it's right now trying to help balance and figure out how I can do that for the long term.
Yeah, this is a question I struggle with every day. And I mean, the truth of it is I think the landscape is changing. It's becoming more conducive to these hybrids. And people like Tyler, Adam, Alexi, if you've met him, and then there's a couple residents are paving the way for others to come in and do things like this. Hopefully, leaving a good reputation behind with the deans and so forth. But I've met, and the med school might hate me for saying this, but I've met people that are part-time residents and are running companies or have full labs. That exists out there. It's possible. We're living in a world now where the majority of the computing power is not in academic institutions. It's out in Silicon Valley. It's in Google and Facebook and Amazon and YouTube, wherever. And so as machine learning, artificial intelligence, and large, highly computationally intensive technologies and tools come into play, frankly, like academic centers may not have the ability to leverage these technologies for the benefit of medicine. So, I believe that there will have to be a shift towards like academic industrialist hybrids that are physicians that have ties to industry and kind of open the doors and are gatekeepers and make sure that things are being done ethically and being done responsibly, but that we still open up the doors for innovation that is necessary. And so, that is a possibility. I've been dreaming of a department of digital health. I don't see any of that in any med schools or any academic centers, but I see it coming. And if no one else does it, I'm going to do it. So do it. So I'm playing around with these ideas, and so even like the hybrid, the model that you go after is something you can innovate. Like even the lifestyle you want to build for yourself, you can entrepreneur it yourself. It all just comes down to what do you want. No, and correct me if I'm wrong, Adam, but I feel like hospitals aren't going to come to you and say, hey, you aren't generating enough RVUs, you're fired. They're just going to say you're not getting paid as much. And so maybe you have 1 or 2 clinic days a week and then you be an entrepreneur on the side. It's all more so about how you support yourself and what you want. And so those models exist. I think the really challenging part is getting through this training period, because yes, we have that golden ticket, and there's less rules that apply to us, but we also just have to do the time. And we don't have the flexibility of our own time. So that's something to think about and thinking, and right now I struggle a lot with, and fortunately I don't have to make the decision now, but how am I going to continue doing this when residency comes about? I don't know. I don't know if I'll be able to. So, that's where my head's at right now.
You answered a lot of the other questions I had as well, so thank you, all 3 of you. That was super helpful. Any other questions from the audience? That was a great one. What else? I'd love to dive into more of that industry movement and shift. I mean, there's huge opportunity for the Amazons, Facebooks, Googles of the world to leverage their computational power and partner in healthcare. So if you could dream up 5 years down the road and kind of address maybe the issues that you each mentioned, EHR or other payment, price transparency issues, what would that be if there was some type of dream partnership and you got to be the physician that got to
So
work on it?
partnership, basically, a large company like Amazon says, all right, you take care of our employees in the best way you can, leveraging whatever it is you want. I think it's a great idea, and I think it's probably the right way to go about improving things. If people talk about access, I think access to capable physicians is critical. There's not a lot of incentives to do that because it's fee for service, and if physicians can take care of a sore throat and get paid the same as a preventative visit, if we're not doing telemedicine or virtual visits and those aren't being reimbursed, that access is limited. So I think, to be honest, I think the best model is what we call direct primary care, and that's becoming more and more popular, where there's concierge medicine doctors that they'll get 500 patients that pay them each $1,000 and they have unlimited access. But there's hybrid models of that where you can have a direct primary care doctor who's there for you 24/7, or a team of doctors there for you 24/7. There's some new startups which are showing transparency, where you can go get your MRI here and it costs $900 to get it here, versus at the hospital it's $3,000. So the company will give you a $100 Amazon gift certificate if you go to the $800 MRI, because everyone wins. So transparency, direct primary care, and access, I think, are some of the things that if you could start doing that, and that's very easy to do, and probably the doctor will be happier, the patients will be happier, the cost will be less. I would start with that. So the transparency thing, I think Bilal mentioned earlier, and then sort of this direct primary care model where you have your doctor, and either that doctor or a group of doctors, very accessible.
This is a tough question. I don't know how to responsibly do this, but I would love if somehow all of the trillion data points that exist out there. Maybe subsets of them that are fully de-identified were made somehow available more in an open source way for innovators and people that are experts in these sorts of methods and in technology to be able to start playing around and tinkering and working with and creating predictive models and assessing the ability to like more quickly fail ideas. If there was something like that, I think that would be really good for healthcare innovation overall.
And I don't know if I have too much else to add to that from the big side of things. I think that you guys nailed it. But I will say from the sort of smaller side of things and, you know, bringing it to you guys, and in terms of like business and physicians, I do think like, you know, the idea of you being able to come up with an idea that, you know, is a business, it's a startup, it's a for-profit entity in most of the cases. I just would like to see that continue to be, you know, okay, you know, to do with healthcare systems, with physicians, et cetera, because I feel like one thing I've noticed is, you know, for some good reasons, I think there's been limitation, certainly with drug companies, device companies, in terms of that interaction. But, you know, like Dr. Bennett said, it is important to have that interaction, and you know, and the more that I think that we can find ways to foster that, so like the AMA does, so that you guys with new ideas can really get access to physicians and collaborate on like new things. I think that's what you need. I'll just say one thing in case it wasn't mentioned, but it turns out there's actually a neat grant way to get funding for a lot of these things, particularly for medical devices and similar things. It works well, and that's called the SBIR and STTR grant program. So it turns out all the organizations in the country that are large enough have to contribute to such programs like the NIH, the National Science Foundation, and the DoD, maybe like 2% of their budget. And they go towards these grants that go to fund partnerships between academia and the business world. And so, you know, in Oblative, we've gotten almost $1 million in grant funding for these really sort of entrepreneurial focused grants where, you know, you do have a private entity. It might be your own company that you started. In our case, it was our own company that we started, and we, you know, applied to do a partnership with, say, you know, Northwestern University, and it's, you know, it's that sort of partnership that gets you the funding. So think about that a little bit as you have ideas. There are ways to sort of blend sort of your worlds by doing something that is both academic, but also can go to serve to, you know, helping your, you know, your venture go forward. And, you know, my opinion on that is, you know, you know, I tend to believe like if you can use like the free market to help you bring something to patients, you know, and it really makes sense, then that's all the more powerful, because I think that that's going to, you know, be able to drive itself to get there, as opposed to, you know, something where you don't have that, you know, understanding.
I just want to add to the SBIR thing. SBIRs are great. And for those of you that might be starting or incubating an idea, there are a number of consulting firms that you can go to that will charge 5 to 10K less to kind of write the entire grant in collaboration with you. You know, especially because a lot of us are doing this. This is our first rodeo, so we've never submitted SBIR grants before, and those are they're real grants applications. They take some time, so you know, you don't have to do all these things yourself either. You can do them with pretty, you know, minimal resources. And if any of you need one, let me know. I know one. I know a good one.
You know a guy?
I know a guy. I have a guy, yeah.
Also, just I know there are a lot of M1s, so I'm trying to put myself in your shoes a little bit. You're halfway, a little past halfway through your first year. It's got to be moderately overwhelming. You know, the first year med school is learning how the body works. Second year is how it could theoretically go wrong. Third and fourth year, you figure out how it actually happens in the real world, what people do about it, and then it goes from there. But so, you know, I remember when I was the first year, it was just a lot of books and trying to keep your head grounded and constantly be reminded of what you don't know. So you will all go through that, and that's normal. But, you know, to the extent you're bored or you're feeling stressed because too much studying, I mean, just recognize that this is a format for ideas that, you know, it's not just books and medicine, it's how that fits into the grand world. So if you get bogged down your first year or second year, just, you know, encourage yourselves to think a little bit out of the box, because I mean, that's I think part of what this meeting is about. And I think it's maybe sometimes tough for first and second years to relate to what we're describing, like direct primary care. What is that? But it's something, and it's important. And you guys, you know, just keep in mind there's a big universe you're still going to learn about. So.
The opportunity as a first year medical or second year, or just even the training path is pretty enormous because you're getting to see the cutting edge of medicine, and you will continue to do that through your training. And so you get to also see the gaps. And so, if I were trying to do this again and come up with ideas, what I do is like keep a journal and write down the ideas I have or the things that just don't seem right. It's like, why do you do that way? That you'll get that little nudge in your mind every now and then, and write that down and ask about it. Ask the physicians, like, why do you treat with them? And you might find out that, well, the technology is limited. We only have this available, and you might know a way to, make it better, or might know the person who knows. And so, that's kind of how it starts, and those are your first ways to de-risk an idea as you go through the training process itself. So take advantage of that.
So as things make sense and don't make sense, really hone in on who your colleagues are, and share those ideas. I think Matter's a really great place to do that. I know you guys even had a workshop about writing SBIR grants, a recurring one. But yeah, absolutely pouring into those resources will be a good one. I saw another hand. Yeah, do you have a question?
Sure. So could you clarify? So the question he asked for everyone else was like, how do we leverage our value proposition for different population demographics? Well, so our symptom checker is focused on triage. And so we are trying to figure out what the next best step is for anyone and make this freely accessible to anyone without them having to pay for it. So that's kind of how we leverage it. We don't target it towards specific demographics. We know who's more likely to use the software in terms of what age ranges and what demographics. But aside from that, we don't really focus on saying that this is better for, I don't know, people in underprivileged areas versus individuals in, I don't know, places that have flu epidemics or something like that. We don't particularly do that. Yeah, it's just more broad. Yeah.
Yeah, Bernadette, I'm actually going to give you this so that they can hear you.
Sure. Okay, so I am not a medical student, but I wonder, if I were a medical student, if you could go back, is there a good year that you would say, if you could redo it, what year would you pick? And then Amanda, a question for you just to share with the medical students too. At what stage in their ideation should they be joining PIN, or is it at any point? So if you could talk a little bit about that.
Okay, I feel like Tyler might be the one to answer this question, but I would say my gut is either right after step one or after you finished your core requirement rotations, maybe.
The question is, what's a good time to take a little break?
Is that what you're asking? Yeah.
Yeah, it's a good question. I feel like when I realized I wanted, was interested in business and medicine stuff, I talked to all these physician business people, not just physician entrepreneurs, but physician business people. And some weren't actually physician business people because they never finished medical school, but some had left to go do their thing during medical school. Some had waited until after to do it. Some had done a year of training, some had done 30. But it was sort of interesting because across the spectrum, like everybody that I had talked to, I had met people who were really successful despite when they left, and in many cases permanently left to do wherever life took them. And I say that mostly just as a sort of a hopeful thing to say that what I feel like I learned is you can be successful at the career that you want to have for yourself no matter what. I feel like there's a lot of pressure, like you were saying, a lot of pressure in the early years. I had friends that left after 1 year, left after 2 years, left after 2 years and came back, left after 2 years, never came back. There's a lot of pressure to conform in medicine, a little bit. There is, to some sort of idea of what what you need to be in. In some respects, there is some level of conformity that that's needed or that happens. But to the other side of things, this is your guy's life, and you're probably all here because in some respects you wanted to help patients, but there's different ways that sort of you can do that. So that's sort of my big message. In terms of if you want to go try something out, I'll speak from my perspective. For me, I use the MBA as a way to go have some protected time, and in my case 2 years. I actually did a combined MBA and Masters of Engineering Management at Northwestern, and that was 2 protected years where I was working hard and studying and learning a lot, but also had a little bit more free time and protected entrepreneurial time to experiment. that I just wouldn't have that kind of time in medical school. So you can think about things like that, and particularly think about ways to make it like a win-win in terms of, maybe you'll go and do a master's degree or some research in the area that you like, but it's translational towards maybe the technology or whatever you're working on. Those can be win-wins that help you figure out if this is something that you want to do. Meanwhile, it'll look good if you come back to medicine and you want to go any which way, whether that's academics, I got this master's degree, or I did this, translational or applied research, or go a different way. So I have always looked for ways to try to have those little win-wins where you can, experiment with new things, try new things that you're interested in, but also, without shooting yourself in the foot or closing any doors.
And to that end, there are so many resources out there that many organizations, the AMA is a big one, that really wants to be a part of helping your journey as a clinician, as a physician, but as an innovator as well. I mean, we talk all the time, every single day, about removing the hurdles and the challenges that are facing physicians in their day-to-day. Decreasing burnout, whether that be because specifically of the EHR. We can do that in a number of different ways. And one of the ways is of attacking that dysfunction is by having physicians have a seat at the table and really have their voice be heard. So a platform that we've developed is called the Physician Innovation Network. My email is up on the screen there, so you guys can reach out to me and I will simply send you an invite to the platform. You can Google it yourself and look it up, but we have about 12,000 users on the platform right now. We have about a 50-50 split between physicians and entrepreneurs. And really, it started out as a matchmaking platform. Where the AMA was a partner of MATTER, still is, but so often had entrepreneurs coming and saying, hey, we need to talk to physicians and we need feedback from them. And then it just became a back and forth email introduction through my boss's inbox. And she was really busy with those one-on-one connections all the time, so decided to turn it into a platform. Where entrepreneurs can post up an opportunity and say, I need feedback on this particular area of my business. It might just be an idea right now, or it might be something that's baked and it might be at stage 5 of a product development and I want someone to talk to, or I need someone on my medical board, or we're looking to bring this to Northwestern. Who do you think I should talk to? I'm about to have a meeting with hospital leadership. How do I prepare best for that? So we've had countless opportunities of myriad different stages. Many of them are physician entrepreneurs. Some of them are students as well. Sling Health has worked with the AMA to develop something called the Clinical Problem Database. And I loved, Bilal, that you said write a journal. Absolutely, keep a journal of like the things that annoy you in healthcare. But once you talk to a few people and once you get that validated a little bit, bring it to us on the clinical problem database and say, this is a problem that I've identified in clinical practice or in studying about clinical practice and I want to go attack it. And maybe I don't want to be the CEO and feel like I have the confidence. Tyler will probably try to talk you into it, but maybe you just want to be the one that kind of raises that flag and states it as a problem and allows someone else to go work on it. So we really want to wrap platforms and programs around you at all of those different stages, whether you just want to be the one that names the problem or you want to be the one that's getting feedback for something that is really far down the pipe. Like Adam joining Kitchery through, connecting on PIN. There's a lot of different inroads, whether you become the physician entrepreneur or you become the physician who gives feedback to to innovators. There's really a lot of different ways to go about it, and it all can be, the cool part that I love, that it can be very targeted to you as an individual and what you're looking for. So don't hesitate to reach out. Don't be a stranger. Matter's a great place to connect. I know that they do a lot of really great events as well. So let us know how we can be helpful. Are there any other questions before we wrap up, finish up with drinks and food, and network more? Yeah. Let me give you this.
Hi, thank you all for sharing your insights. So I speak for everyone here that we gleaned a lot from it. But I just had I don't know if this is the most coherently put question, but when I imagine, we're in medical school right now, and we have peers that we are kind of in the same boat with, and that there's at least a program at UIC where a lot of us are from that is targeted towards innovation medicine. And so we're in this environment where we are continuing to work with people with innovation mindsets. But as we go on to residency and being attendings, we might not be surrounded with the same kinds of people with that same mindset. And then I'm just wondering if there's a way that you guys are thinking of to kind of maintain that edge of just thinking creatively and then continue to be innovators in your space, no matter what kind of residency you end up in, no matter like what specialty or culture that those residency programs may have.
Yeah, maybe I can share a few thoughts. But one, you guys are really lucky in that where we're sitting right now didn't exist a few years ago, and this is like, in many respects, Matter with the help of AMA is like the center heart of like the early stage entrepreneurship innovation community in really Chicagoland, maybe even the entire Midwest of the country. And it's tough to tell you that it just did not exist a couple years ago. I mean, 10 years ago, I was about in your seat. Like literally, like there wasn't anything quite like this. There was an organization called Propel that did some programming in different places, and that was helpful. But there just wasn't a sense of community around innovation like there is now. A lot of people that had that interests ended up finishing their MD or PhD or whatever, and then flying, out west or maybe to Boston, out east, and then taking their good ideas with them. And that's a real reason for why, we're sitting here right now. Is because a bunch of people said, well, hey, there's a bunch of great ideas, great people, great hospitals, medical schools, the AMA, and good organizations right here in Chicagoland. Like, why can't we foster a lot of this innovation culture here? And, I will tell you, I mean, it's been amazing what's been done in just a couple of years. So, to answer your question, where can you go? Well, one place you can start is like literally like right here. There's awesome programming, all the same things that like I was scrounging for and looking around to try to just get some of that education is wrapped up like right here at Matter. And so, between AMA and just Matter here, you can find a bunch of neat programming. You can come to events like this to stay connected. There are other professional organizations I know you're involved with as well that like are, for physician entrepreneurs. So, I think a big part of it is literally just, if you're interested in being involved, just staying connected with the network and meeting people and talking to people. And instead of staying in and studying that one night, like making it out, I'm so far behind in studying for my shelf exam Friday, like you have no idea. I could stay up 24/7. I wouldn't get it all the studying I need to get done. But I'm here, to be part of the community with you guys. And so I think, that's part of it. Just talking to people and being part of a community, because, everyone who becomes part of it sort of supports each other, and that's a big reason why, we're all successful together.
I can totally relate to your question, and I think every point Tyler made is great. But you're going to be in another community, and that's a community of residents and interns who are trying to accomplish and learn some important skills. And so they might not be the same way. And that's going to be a journey you all have to go through, like I said earlier. But you're going to be stuck with, as a second-year intern, like your patient has a weird lab value, and your preceptor is going to say, you got to figure that out. What are you going to do? And if you don't, you have to figure out next steps for your patient. What's the testing going to be? How are you going to communicate that? That's all part of residency. But that's a finite part of the day. And some people go home and exercise. People go home and exercise and watch TV. But you can still come to these meetings, be online. You can still have that, thing on the back burner that you're always engaged in. You don't. It's not either or. And you can definitely cultivate other skills.
And I have some stuff to add too. I think all those are definitely all those are great opportunities, and definitely do that. Some additional ways to think about it are, one thing to think about is like, what role do you want in the innovation process? And so as an example, we are right now working with a University of Chicago emergency medicine resident who came to us and said, hey, I want to help you guys out. Like, is there anything low stress that isn't on a specific deadline, but if no one else is doing it, it wouldn't get done, that I could help with. And so we said, there's a study that you could kind of put together, and you know what we'll do? We'll get some interns on it, we'll get some med students to help out, and you can kind of have a little team and just do it whenever. There's no rush, but if you get it done, it'll be really helpful to us. And in the process of him doing that, kind of just a few hours here and there, he's becoming an expert in all of our competitors, because it has to do with the comparison of us and our competitors. And now he's coming back to us and saying, hey, like, I know all these detailed things about how your product is different from your competitors, and here's things that you should consider building. So now it's not just research, now he's suggesting product development ideas to us, and he's on like the product side now, and because he's the expert on it, he's in every conversation on, what we should do about that specific aspect of the product. And it's just kind of growing from there naturally. Another model to think about is, when you are in that phase, applying a residency or moving forward in your training path, kind of be forthright. You can ask about that in your interviews. Like, what is the innovation space like here? You can say, honestly, like, as a resident, I know that I might not have the time to start and run a company, but if I have an idea, are there resources to help me, bring that up or hand it off to someone or work with a team? For example, I know at Northwestern, there's like a class called NUvention where engineers, physician, med students, law students, and business students all kind of team up. So that's one opportunity. And also, you can get a sense of it by reading between the lines by looking at the faculty. A lot of faculty have companies inside. And if you're at an institution where a lot of faculty have companies on the side, they're probably somewhat flexible and open to that. And that means that you can probably go to your faculty and say, hey, I know I'm a resident, or I know I'm a medical student, I don't have much time, but I have this really cool idea. Is there any way to kind of get this off the ground? Because they would probably be sympathetic to that, considering that they're businessmen too. So there's ways to kind of to do it as you go, I think.
Yeah, maybe if I can just say one more plug. You brought up a really good point. There are a lot of startup companies out there at Matter, elsewhere, that are like looking for hungry, interested people to help out with things, even if it is one-off project. Like, so you guys can look at Matter, you can use AMA, whatever, to like help find out some companies, and it's totally reasonable for you to reach out to them, or through AMA or through Matter, and just say, hey, I'm like a medical student, I'm an M1, M2, 3, whatever. I don't have a lot of time, but I have a little bit of time to do something. Rather than watching TV, and I'd love to like help you out with a defined project, whatever. That's a great way for you guys to learn, about that stuff. And I'll just tell you one quick example. We had a medical student who, was going to be an orthopedic surgeon, and he interned for us the year before medical school and the summer between his M1 and M2 year. And all of a sudden, he's getting more interested in entrepreneurship. We give him some serious projects. He really delivered great work that helped sort of, define our business and the strategy. And now he's just finished. Now he decided to go do his MBA while he's at Penn. So he's in his MBA year. And I don't think he's actually going to do a residency. I think he's going to go into the entrepreneurship and venture capital type stuff. So you can do something like that to sort of test it out just by helping out with one limited project.
So on a practical note, that's also something that the platform enables you to do. A lot of the opportunities that are on PIN are volunteer opportunities, because they're just simple conversations, or, hey, I need feedback, and it's going to be a quick call or a quick survey that you can take online. There are some paid opportunities too, and I know that a lot of the innovation and ideas that come in this space, so much of the conversation that we've had today has been really rooted, as it should be, in improving patient care and improving the lives of physicians and bringing the industry forward and really making a change. But there are also opportunities when you're diversifying your time to diversify your income too. And as you take on projects, sometimes that leads into really cool business opportunities, and sometimes that leads into, stepping back and going part-time in the clinic and really stepping into leadership in a company as well. So I think that's an important thing to note, just as like a logistical thing, that you can start learning about what those opportunities look like now. Even if you're not ready to give a lot of great feedback quite yet, because you're in 1 year and you haven't really been seeing patients yourself yet, it's always helpful to watch and learn and see what is coming down the pipe for you. So please help me and thank these amazing panelists who are not studying right now, but with us instead and have long commutes. Thank you.
Thanks for having us.